Hi, I'm Dr. Vosburg, and in this video I'd like to talk to you about NSAID use after weight loss surgery. NSAID stands for non-steroidal anti-inflammatory medication. Medicines that are considered NSAIDs include things like aspirin, ibuprofen, naproxen, also known as Aleve. These medicines are available over the counter and generally used for aches and pains, joint pains, headaches, etc. Whenever we talk about NSAID use after bariatric surgery, it's very important that a patient knows specifically which surgery they had because the recommendations are different depending on the procedure. For patients who've had gastric bypass surgery, we highly recommend that all NSAID medications are avoided after that procedure. This is because there's a new connection between the stomach and the intestine, and even a short-term use of these NSAIDs or non-steroidal anti-inflammatory medications can really increase a person's risk for developing ulcers at that site. Ulcers can cause pain, have bleeding issues, a variety of other things that are problematic for patients. So if you've had gastric bypass surgery, remember that NSAIDs are not a good option to use for aches and pains, but Tylenol is always okay to use. For patients who've had sleeve gastrectomy surgery, things are a little bit different. Because there's no new connection between the stomach and the intestine, the likelihood of developing ulcers in that area is the same as it is with your normal stomach. So if a patient has had a sleeve gastrectomy surgery, it's actually safe for them to use NSAID medications for aches and pains after surgery. The most important thing is just to take it per the recommendations on the box. Also, some tips that can help are to take these medications with food whenever you have them, and try to use them for less than 10 days whenever you're experiencing aches and pains. If things last longer than that, just contact your surgeon or your doctor, and we'll be able to give you some alternative things to use. Also, sleeve gastrectomy patients, in addition to being able to use NSAIDs, can also take Tylenol for aches and pains too, which is also safe for gastric bypass patients too.